Question 87. A client is being weaned from parenteral nutrition, PN, and is expected to begin taking solid food today. The ongoing solution rate has been 100 ml per hour. A nurse anticipates that which of the following prescriptions regarding the PN solution will accompany the diet order? A. Discontinue the parental nutrition. B. Decrease PN rate to 50 ml per hour. C. Start 0.9% normal saline at 25 ml per hour. D. Continue current infusion rate orders for parental nutrition. Correct answer, B. When a client begins eating a regular diet after a period of receiving PN, the PN is decreased gradually. PN that is discontinued abruptly can cause hypoglycemia. Clients often have anorexia after being without food for some time, and the digestive tract also is not used to producing the digestive enzymes that will be needed. Gradually decreasing the infusion rate allows the client to remain adequately nourished during the transition to a normal diet and prevents the occurrence of hypoglycemia. Even before clients are started on a solid diet, they are given clear liquids followed by full liquids to further ease the transition. A solution of normal saline does not provide the glucose needed during the transition of discontinuing the PN and could cause the client to experience hypoglycemia. Question 88. A nurse is preparing to change the parenteral nutrition, PN, solution bag and tubing. The client's central venous line is located in the right subclavian vein. The nurse asks the client to take which essential action during the tubing change? A. Breathe normally. B. Turn the head to the right. C. Exhale slowly and evenly. D. Take a deep breath, hold it, and bear down. Correct answer, D. The client should be asked to perform the Valsalva maneuver during tubing changes. This helps avoid air embolism during tubing changes. The nurse asks the client to take a deep breath, hold it, and bear down. If the intravenous line is on the right, the client turns his or her head to the left. This position increases intrathoracic pressure. Options 1 and 3 are inappropriate and could cause the potential for an air embolism during the tubing change. Question 89. A client with parenteral nutrition, PN, infusing, has disconnected the tubing from the central line catheter. A nurse assesses the client and suspects an air embolism. The nurse should immediately place the client in which position? A. On the left side, with the head lower than the feet. B. On the left side, with the head higher than the feet. C. On the right side, with the head lower than the feet. D. On the right side, with the head higher than the feet. Correct answer, A. Air embolism occurs when air enters the catheter system, such as when the system is opened for intravenous, 4, tubing changes or when the 4 tubing disconnects. Air embolism is a critical situation. If it is suspected, the client should be placed in a left side lying position. The head should be lower than the feet. This position is used to minimize the effect of the air traveling as a bolus to the lungs by trapping it in the right side of the heart. Options 2, 3, and 4 are incorrect positions if an air embolism is suspected. Question 90. A client receiving parenteral nutrition, PN, complains of a headache. A nurse notes that the client has an increased blood pressure, bounding pulse, jugular vein distention, and crackles bilaterally. The nurse determines that the client is experiencing which complication of PN therapy? A. Sepsis. B. Air embolism. C. Hypervolemia. D. Hyperglycemia. Correct answer, C. Hypervolemia is a critical situation and occurs from excessive fluid administration or administration of fluid too rapidly. Clients with cardiac, renal, or hepatic dysfunction are also at increased risk. The client's signs and symptoms presented in the question are consistent with hypervolemia. The increased intravascular volume increases the blood pressure, whereas the pulse rate increases as the heart tries to pump the extra fluid volume. The increased volume also causes neck vein distension and shifting of fluid into the alveoli, resulting in lung crackles. The signs and symptoms presented in the question do not indicate hyperglycemia, air embolism, or sepsis. Question 91. A client is receiving nutrition by means of parenteral nutrition, PN, A nurse monitors the client for complications of the therapy, and assesses the client for which of the following signs of hyperglycemia? A. Fever, weak pulse, and thirst. B. Nausea, vomiting, and oliguria. C. Sweating, chills, and abdominal pain. D. Weakness, thirst, and increased urine output. Correct answer, D. The high glucose concentration in PN places the client at risk for hyperglycemia. Signs of hyperglycemia include excessive thirst, fatigue, restlessness, confusion, weakness, Kussmaul's respirations, diuresis, and coma when hyperglycemia is severe. If the client has these symptoms, the blood glucose level should be checked immediately. Options 1, 2, and 3 do not identify signs specific to hyperglycemia. Question 92. A nurse is changing the central line dressing of a client receiving parenteral nutrition, PN, and notes that the catheter insertion site appears reddened. The nurse next assesses which of the following items? A. Client's temperature. B. Expiration date on the bag. C. Time of last dressing change. D. Tightness of tubing connections. Correct answer, A. Redness at the catheter insertion site is a possible indication of infection. The nurse would next assess for other signs of infection. Of the options given, the temperature is the next item to assess. The tightness of tubing connections should be assessed each time the PN is checked. Loose connections would result in leakage, not skin redness. The expiration date on the bag is a viable option, but this also should be checked at the time the solution is hung and with each shift change. The time of the last dressing change should be checked with each shift change. Question 93. A nurse is preparing to hang fat emulsion, lipids, and notes that fat globules are visible at the top of the solution. The nurse takes which of the following actions? A. Rolls the bottle of solution gently. B. Obtains a different bottle of solution. C. Shakes the bottle of solution vigorously. D. Runs the bottle of solution under warm water. Correct answer, B. Fat emulsion, lipids, is a white, opaque solution administered intravenously during parenteral nutrition therapy to prevent fatty acid deficiency. The nurse should examine the bottle of fat emulsion for separation of emulsion into layers or fat globules or for the accumulation of froth. The nurse should not hang a fat emulsion if any of these are observed and should return the solution to the pharmacy. Therefore, options 1, 3, and 4 are inappropriate actions. Question 94. A client receiving parenteral nutrition, PN, suddenly spikes a fever. A nurse notifies the physician, and the physician initially prescribes that the solution and tubing be changed. The nurse should do which of the following with the discontinued materials? A. Discard them in the unit trash. B. Return them to the hospital pharmacy. C. Send them to the laboratory for culture. D. Save them for return to the manufacturer. Correct answer, C. When the client who is receiving PN spikes a temperature, a catheter-related infection should be suspected. The solution and tubing should be changed, and the discontinued materials should be cultured for infectious organisms. The other options are incorrect. Because culture for infectious organisms is necessary, the discontinued materials are not discarded or returned to the pharmacy or manufacturer. Question 95. A client has been discharged to home on parenteral nutrition, PN. With each visit, a home care nurse assesses which of the following parameters most closely in monitoring this therapy? A. Pulse and weight. B. Temperature and weight. C. Pulse and blood pressure. D. Temperature and blood pressure. Correct answer, B. The client receiving PN at home should have her or his temperature monitored as a means of detecting infection, which is a potential complication of this therapy. An infection also could result in sepsis because the catheter is in a blood vessel. The client's weight is monitored as a measure of the effectiveness of this nutritional therapy and to detect hypervolemia. The pulse and blood pressure are important parameters to assess, but they do not relate specifically to the effects of PN. Question 96. A nurse is caring for a group of adult clients on an acute care medical surgical nursing unit. The nurse understands that which of the following clients would be the least likely candidate for parenteral nutrition, PN? A. A 66-year-old client with extensive burns. B. A 42-year-old client who has had an open cholecystectomy. C. A 27-year-old client with severe exacerbation of Crohn's disease. D. A 35-year-old client with persistent nausea and vomiting from chemotherapy. Correct answer, B. Parenteral nutrition is indicated in clients whose gastrointestinal tracts are not functional or who cannot take in a diet enterally for extended periods. Examples of these conditions include those of the clients identified in options 1, 3, and 4. Other clients would be those who have had extensive surgery, have multiple fractures, are septic, or have advanced cancer or acquired immunodeficiency syndrome. The client with the open cholecystectomy is not a candidate because this client would resume a regular diet within a few days following surgery. Question 97. A nurse is preparing to hang the first bag of parenteral nutrition, PN, solution via the central line of an assigned client. The nurse obtains which most essential piece of equipment before hanging the solution? A. Urine test strips. B. Blood glucose meter. C. Electronic infusion pump. D. Non-invasive blood pressure monitor. Correct answer, C. The nurse obtains an electronic infusion pump before hanging a PN solution. Because of the high glucose content, use of an infusion pump is necessary to ensure that the solution does not infuse too rapidly or fall behind. Because the client's blood glucose level is monitored every 4 to 6 hours during administration of PN, a blood glucose meter also will be needed, but this is not the most essential item needed before hanging the solution. Urine test strips, to measure glucose, rarely are used because of the advent of blood glucose monitoring. Although the blood pressure will be monitored, a non-invasive blood pressure monitor is not the most essential piece of equipment needed for this procedure. Question 98. A nurse is making initial rounds at the beginning of the shift, and notes that the parenteral nutrition, PN, bag of an assigned client is empty. Which of the following solutions readily available on the nursing unit should the nurse hang until another PN solution is mixed and delivered to the nursing unit? A. 5% dextrose in water. B. 10% dextrose in water. C. 5% dextrose in Ringer's lactate. D. 5% dextrose in 0.9% sodium chloride. Correct answer, B. The client is at risk for hypoglycemia, therefore the solution containing the highest amount of glucose should be hung until the new PN solution becomes available. Because PN solutions contain high glucose concentrations, the 10% dextrose in water solution is the best of the choices presented. The solution selected should be one that minimizes the risk of hypoglycemia. Options 1, 3, and 4 will not be as effective in minimizing the risk of hypoglycemia. Question 99. A nurse is monitoring the status of a client's fat emulsion, lipid, infusion, and notes that the infusion is 1 hour behind. Which of the following actions by the nurse is appropriate? A. Adjust the infusion rate to catch up over the next hour. B. Increase the infusion rate to catch up over the next 2 hours. C. Ensure that the fat emulsion infusion rate is infusing at the prescribed rate. D. Adjust the infusion rate to run wide open until the solution is back on time. Correct answer, C. The nurse should not increase the rate of a fat emulsion to make up the difference if the infusion timing falls behind. Doing so could place the client at risk for fat overload. Additionally, increasing the rate suddenly can cause fluid overload. The same principle, not increasing the rate, applies to PN or any intravenous, infusion. Therefore options 1, 2, and 4 are incorrect. Question 100. A client receiving parenteral nutrition, PN, in the home setting, has a weight gain of 5 pounds in 1 week. The nurse next assesses the client to detect the presence of which of the following? A. Thirst. B. Polyuria. C. Decreased blood pressure. D. Crackles on auscultation of the lungs. Correct answer, D. Optimal weight gain when the client is receiving PN is 1 to 2 lb/week. The client who has a weight gain of 5 lb/week while receiving PN is likely to have fluid retention. This can result in hypervolemia. Signs of hypervolemia include increased blood pressure, crackles on lung auscultation, a bounding pulse, jugular vein distension, headache, and weight gain more than desired. Options 1 and 2 are associated with hyperglycemia. Option 3 is likely to be noted in deficient fluid volume. Question 101. A nurse is caring for a restless client who is beginning nutritional therapy with parenteral nutrition, PN. The nurse should plan to ensure that which of the following is done to prevent the client from injury? A. Calculate daily intake and output. B. Monitor the temperature once daily. C. Secure all connections in the PN system. D. Monitor blood glucose levels every 12 hours. Correct answer, C. The nurse should plan to secure all connections in the tubing. Tape is used per agency protocol. This helps prevent the restless client from pulling the connections apart accidentally. The nurse should also monitor intake and output, but this does not relate specifically to a risk for injury as presented in the question. Also, options 2 and 4 do not relate to a risk for injury as presented in the question. In addition, the client's temperature and blood glucose levels are monitored more frequently than the timeframes identified in the options to detect signs of infection and hyperglycemia, respectively. Question 102. A nurse is monitoring a client receiving parenteral nutrition, PN. The client suddenly develops respiratory distress, dyspnea, and chest pain, and the nurse suspects air embolism. Number the actions that the nurse would take in order of priority. Number 1 is the first action and number 6 is the last action. Administer oxygen. Contact the physician. Document the occurrence. Take the client's vital signs. Clamp the intravenous, 4, catheter. Position the client in left Trendelenburg's position. Correct answer, 4, 3, 6, 5, 1, 2. Air embolism occurs when air enters the catheter system during 4 tubing changes or when the 4 tubing disconnects. Air embolism is a critical situation. If air embolism is suspected, the nurse would first clamp the 4 catheter to prevent further introduction of air and the air embolism from traveling through the heart to the pulmonary system. The nurse would next place the client in a left side lying position with the head lower than the feet, to trap air in right side of the heart. The nurse would notify the physician and administer oxygen as prescribed. The nurse would monitor the client closely and take the client's vital signs. Finally, the nurse documents the occurrence.